talked about the cognitive, a big part of the cognitive aspect of it. Talk a little bit about that. When people are dealing with mental illnesses, and basically cognitive just really means their functioning of their brain in an area of being able to get things done, maybe it's the concentration. So talk a little bit about that. Talk a little bit about what that means as far as that.
Sure. From the research that's out there, I think it's widely accepted that persons with schizophrenia tend to have general global cognitive impairment less than that would be expected for a same-age individual.
And it shows how. How does that show? What are some of the signs and symptoms of poor cognition?
So a person might have problems if it's related to their planning or judgment. They might have trouble making decisions with motivation, which is also described as a negative symptom.
Yes.
And so just to carry out day-to-day activities becomes much more of a chore.
Right.
And even the more challenging day-to-day activities that people are obliged to take care of, like taxes, getting on the subway, finding their way to work, etc., keeping up with all the demands in a workday, those become particularly challenging for a person with psychosis and schizophrenia.
Now we talk about cognitive as being, well, when we look at schizophrenia and symptoms, we talk about positive symptoms, the things that are added to your personality that shouldn't be there, the hearing of the voices, the chemical imbalance. You may be paranoid, delusions, illusions, hallucinations. All this stuff are positive symptoms of schizophrenia. With negative symptoms, we have like lack of motivation, a lack of drive, emotional bluntness, no interest, different things like that, lack of energy, depression can set in. Where does cognitive fall in there? Is cognitive more of looked upon as a positive symptom or a negative symptom? Can you speak to that a little bit?
I think where we're at contemporarily is that people tend to see it as a domain related but independent from those other two.
So it would actually be a third class. So we'd have positive symptoms, negative symptoms, or deficit symptoms as they're called, and then cognitive symptoms. Is that correct?
I would agree with that.
Okay, good.
And then in relation to insight, I would argue that insight or impaired illness awareness is a domain independent of all of those as well.
Oh, okay.
That heretofore has been neglected in the research community.
Right. Now, can you talk a little bit about the percentages of, say, insight? So if what percent of people who are diagnosed with, say, schizophrenia have insight into their illness and can understand that they do have an illness and that they do need treatment, they need to be continued treatment. So talk a little bit about those statistics.
Sure. So there was a large World Health Organization study that showed that 90% of, actually more than 90% of persons with schizophrenia had impaired insight at some point in their illness.
Yes.
And more than 50% had moderate to severe insight impairment at some point in the illness.